Okay, I am doing the catheter demonstration. Some reasons we may do this is in labor if they're having trouble voiding, or postpartum if their uterus may be displaced, we may be feeling a full bladder, but maybe it's too soon for them to get up and walk, or maybe they don't feel strong enough to get up and walk, or maybe they just don't want to get up and walk. Another reason may be if they are bleeding. So actually yesterday we were at a birth and it was just like continuous cramping and bleeding. She ultimately ended up hemorrhaging quite significantly, but because there were 3 midwives in the room and we had time, we were able to administer meds and do a cath, and it potentially could have helped a lot. It definitely helped relieve her discomfort, but like I said, ultimately it wasn't the cure to the problem, but if it works, it works. So, informed consent, of course, you would identify when it's indicated for various reasons. It's totally a case-by-case basis. Talk to them about why you feel a catheter is necessary, i.e., hey, your bladder is really full. We can feel your uterus displaced to the right. What are your thoughts on getting up and going to the restroom? Well, midwife, I don't want to get up and use the restroom. Or I tried to go to the restroom and I didn't have the urge and I wasn't able to go. So then you could say, okay, we would like to place an in and out catheter. So it just goes in, urine comes out into the bucket, bowl thing, and then we take it right out so it doesn't stay in. It's a sterile procedure, and so what are your thoughts? The clients, I've never heard one deny. So by the time we're recommending it, they're easy to do it. And so make sure you ask if they have any more questions, and then talk them through the procedure while you're actually doing it. So they come in kits. They come with 3 swabs, the catheter, which is a straw, sterile gloves, and a sterile drape, and sterile gel as well. So here, this is going to be my urethra, my coffee cup. Really, it should be up here. So let's see. Here's my sterile drape, my past due lab core. I need to pay that. And my cath, my 3 swabs, my gloves, and then we should have gel, but we don't, so we'll pretend. So first things first is coming in. Okay, we're going to do this catheter. Are you still on board with that? Yes, midwife, I am. Okay, there's sterile gloves, but these are not. So then I would open my, I would take out my sterile field here and help the client or ask the client to lift up their bottom and just place it underneath. And then I would open my sterile cleaning swabs, place them in my, I call it a bucket, but container. And then I would open my sterile gel, place it in my container as well, and then open my cath. And if it's not already open, ours actually come open, and place it in the bucket as well. It's like a long rectangular thing. So then I'm going to take first swab and clean outside, discard, second side, discard, middle, discard. Stick the tip of my cath into the sterile gel, take it out, it's still sterile. With my non-dominant hand, part the labia, identify the urethra, and then slide in. Once I get urine, I'm going to go about an inch further, and then this would be collecting urine in the container that I still don't know what the name is. And then once it's emptied, once the bladder is emptied, I would pinch the end and pull it out. And then ensure the client feels okay, likely do a fundal check, and then other than that, then I would just throw away my sterileness and and like check how many cc's, chart it, and then just like I said, make sure the client is okay and feels okay from the procedure. And that's it.